like to review with you getting your wisdom teeth taken out. So it's one of the procedures we do quite a bit here in our office, and I kind of wanted to go through your journey when you come see us. So most patients get referred by their dentist or their orthodontist because their wisdom teeth may be causing crowding. A lot of people get little infections around them and they hurt, so that's what brings most people in. A lot of patients just come without a doctor referral because we've done their friends or they just want to get their wisdom teeth out. About half our patients come in ahead of time for a consultation, and about half just meet us the day of surgery. And that's kind of up to you what your comfort level is, if you want to come meet us first or just come in that day and save yourself a trip. So the day you come in, you need to have an empty stomach. That's just what makes it safe to go to sleep, because we do put you all the way to sleep. You need somebody to drive you home. Your appointment, you usually hear about an hour and a half that day. It takes myself and my nurses about 30 minutes to do your procedure. But we have you get here a few minutes early to bring you in the room and explain things to you. There's about a 30-minute recovery afterwards. So the nice thing is we can put you completely to sleep. That's one of the special attributes of our office. So you'll be all the way to sleep. You don't feel anything. You're not half sedated. And you're sitting still, and we can actually be gentler too. And once you're asleep, we give you Novocaine that keeps it numb for about 10 or 12 hours, which is a mega help. We do give you some pain medication to take afterwards. So when you go home that day, we give you an ice pack, and you're not going to remember this as really a painful procedure. You're just going to remember you had puffy cheeks for a couple of days, and some people don't swell a lot, but some do. We do give you an ice pack to wear to keep on for a couple of days that weekend or whenever you do it afterwards, just for the swelling while you're awake. Also, in your IV as you're going to sleep, we give you an anti-swelling drug called Decadron that significantly cuts down on the swelling. It's a really big help. So some of our patients actually don't get too swollen. So as far as your recovery, we usually recommend you stay in that night. Some people we do on Friday nights. Kids go to football games in high school that night, although we don't highly recommend it. But the next day you go out and about. But if we do it on a Friday, most children do go back to school on a Monday, although we do these every day of the week. And you also need to avoid foods like popcorn, things like that. It's not a real big deal. You can eat most foods afterwards. And we typically see you about a week later for your follow-up, and that's pretty much it.